Alrighty, good morning, everybody. What I have for you is I am going off the concussions PowerPoint that I made, and this is just basically an overview. Like I've told you in class, literally, this probably I love concussions. Like honestly, this is my thing. When I was in West Virginia, I helped Marshall and basically the entire state get their concussion protocol passed, and actually Kentucky adopted a lot of it as well. So, I mean, it wasn't just me, it was me and a set of doctors, but that's neither here nor there. I'll tell you about exactly what that protocol was when we dive into return to play protocol. So this is strictly just athletics, all right? So if you're following along with me on this PowerPoint, I'm going to the definition. So this is straight up the definition as the NATA reads it. I want you to understand that concussions are not just formed with a shot to the head. It can be anywhere in the body. A lot of times they misdiagnose it because it is a shot to the spine, and it can be basically transferred up into the head. And a lot of people call it like getting your bell rung or getting it jarred. But either way, if somebody takes a shot to the back, takes a shot to the chest, obviously a shot to the head, either one of these can produce concussion symptoms to the point where they can get diagnosed with a concussion. So you got to remember to think outside the box when we're talking about this. The other thing I want to mention is whatever I teach you today, the fast science of this is changing so much that literally it can be basically discredited tomorrow. Somebody can come up with different kind of concussions, especially with the CTE talk. I'm not going to get really big into that because that's a lot of post-concussion stuff, and in this class I just want to focus on when the concussion happens and how we're going to get them back to return to play. So if we're going on, I'm just going to kind of skip around here. You guys can obviously read this for yourself, but this is just a whole bunch of definitions. If we're looking at the next slide, which is slide 3, I want you to understand that it's a graded or a lot of symptoms all put together, not necessarily in a grade like I was getting ready to say, because that's the old school way of thinking. Back when I was playing sports, this is not that long ago, literally concussions were graded on a 1, 2, and 3 scale, 1 being mild, 3 being obviously severe, and you actually, if you got knocked out per se, that's when the doctor would just say, okay, he got knocked out, that's a grade 3 concussions. We do not grade like that anymore, but we do take a list of grades of different kind of symptoms. So obviously feeling fatigue, ringing in the ears, seeing spots, obviously memory, things like that all come into factor. We'll get more to that on what exactly symptoms we're looking for when we go on field. So today I'm just going to, again, just real quick on the definition. If you go into classification, so we have abandoned, just like I told you, the grading scale and the the simple versus complex terminology. Literally, I want you to get through your head. If you're going to listen to me at all today, there is no such thing as a mild or severe concussion. A concussion is a concussion. It depends on how long it takes that athlete or that patient to come back from the concussion. It can be completely different for me versus somebody else. It doesn't mean that I'm a fast healer or anything like that. It just depends on how your body responds to that, okay? I'm sure a lot of people have had concussions before. If you truly had a concussion and got diagnosed, it is confusing, it is scary. That's why we got to make sure that we are looking at these and we treat them the right way. I like to tell people, again, just like with the knee, like I was telling you, or any kind of injury, there is life after sports, and the one thing that you don't want to mess with is your brain. So there's that. We've obviously retained the concept that majority, 80 to 90% of concussions do resolve in a 7 to 10 period time. That is based on actual, science and statistics and things like that. But I don't want you to think, or I don't want you to tell your athletes or patients, hey, you'll probably be feeling better within 9 to 10 days. You keep that information to yourself, okay? Again, it may be longer in children and adolescents. That's because their mind is still developing. And we just want to make sure that you want to be ultra conservative on any concussion, but we want to really make sure that we're looking at this of any child if they're slow behind any kind of development issues or anything like that. So your signs and symptoms, again, obviously in a true concussion, you're going to have a headache. If anybody's ever had a concussion before, feeling like in a fog. The way how I kind of clarify this is it's not necessarily that you feel drunk, you just feel confused and you just can't focus on anything. Some people get emotional. If I was in class right now, I'd tell you a bunch of funny stories and stuff like that, but sometimes they're not funny. And the reason why people get emotional is because think of the worst migraine or the worst headache you've ever seen. You want that pain to go away. You don't understand what's going on. Everybody around you, maybe you're in the middle of a game, is like looking at you, and you feel like all eyes are on you, and you're trying to remember exactly what happened. So your physical signs, some people do have loss of consciousness. I've never seen personally myself. I've dealt with tons of concussions. Nobody out longer than 10 seconds. You do have amnesia sometimes regarding depending on how hard the hit was. There are two different grades of amnesia. One is retrograde, one is antegrade. Retrograde means you can't remember anything before the hit, which is it's kind of rare, but it still happens. And the next one is antegrade, where basically you can't really remember everything after the hit. And it's like that's the most common because you're trying to remember exactly what happened, who told you what, and trying to go through the events of what happened there. Cognitive impairment, again, slowed reaction times, and definitely you're going to be drowsy with sleep disturbances. It used to be they wanted you to get all the sleep that you wanted to, and I'll kind of go back on that and return to play. So our on-field sideline evaluation, I'm gonna skip this because my next PowerPoint on Thursday is going to be over this, and I want to really hit down on this. I want you to just remember that the SCAT-2 on this on-field or sideline evaluation slide, that's what we're going to be looking at. That is like literally a athletic trainer or physical therapist or anybody that can diagnose, a nurse, doctor. If they're on the field, this is literally a dummy proof on how to look at concussions. It gives you exactly what to look for, exactly what to say to the athlete if you don't know, and then you can make your decision from there, all right? I do want you to look at the last bullet point, though. A player that has been diagnosed with a concussion should not be allowed to return to play. I want you to get through your head. It is very rare that it happens these days, but you always have somebody out there that's like, no, I think he's okay, or she's okay, or something like that. No, I'll tell you my whole thing when we get to on-field sideline evaluation of how I do return to play protocols, okay? So your investigations, this is what I always tell people. If you absolutely can, and for those of you that play sports on campus right now, if you absolutely can, a lot of people, if they have the time, I didn't have the time. I did up at Marshall, but it was really hard on campus with me just going between campus and clinic and everything like that. It's really hard to get a baseline test before season because what people can do is get a baseline test and then if somebody gets a concussion, you can compare your stats and stuff like that. It's not the telltale sign. It's just a tool to have in your back pocket. That way you can say, yeah, I guess their balance was really off and they were really good before season. It's something to look at. Let's take a more hard look at them. They used to have impact testing. I'm not a big fan of impact testing anymore. A lot of people dismiss it now. It's a 45-minute test. You guys can look that up. That is literally, if you're not even concussed, it's hard to pass, and it gives you a headache no matter what. And the problem is just the resources available for that. One, it costs a lot of money, especially the high schools. And then two, it's really hard to do it their way. And again, it's not the telltale sign. So going on down, our cornerstone, I'm on management now. Our management section, it says rest until asymptomatic. If you do not know what asymptomatic means, it means absolutely no symptoms. The biggest thing that we can tell people with concussions now is rest, rest, rest. You can even get a school excuse and get out of like quizzes and classes and stuff now. It's literally a university excuse if you have a concussion, because even things like watching TV, reading a book, anything that stimulates your mind is working. I mean, it's just like if you were using a muscle that's been injured or sore, you literally got to look at that, okay? And you got to make sure it's rested, and your brain's obviously the most important thing, so we want you to rest. However, I don't like telling people, hey, just sit around, okay? I don't like them playing some kind of complicated video games or something like that, and I don't like them taking a lot of sleep. If you are a person that doesn't take naps in the middle of the day, then you keep your same schedule. Don't all of a sudden give it an excuse just to be like, oh, I'm just going to sleep all the time because, Brett or my doctor said rest. And it's like, no, try to keep your same schedule as far as sleep goes and things like that, okay? Biggest thing is when you're watching television, I usually tell people don't watch television. I know they are going to watch. Just make sure it's something simple. It's not like a big action scene, some kind of sci-fi thing that you're sitting there trying to focus in on it, because it could recreate symptoms. If you've ever had a concussion or know somebody, this is 100% what it does. It literally starts giving you a headache and things like that. So just make sure that you're focusing. The biggest thing that we look at now is the phone and making sure that nobody's looking at it pretty hard and things like that. Going down to sports concussions, again, I have this on our slide. It's like follow-up management. Literally, guys, like I just said, rest, rest, rest. And I told you, you guys can expect a gradual resolution within 7 to 10 days. This is where your team comes in. Everybody a part of the sports medicine team. Me as the athletic trainer, I'm probably going to be one-on-one with this patient. I'll go through a whole online and my whole protocol, what I do. It's super conservative, but I'm also talking with my docs, and I'm also talking with parents. I'm talking with everybody surrounding this player or athlete, okay? And then once they come up to me after 24 hours, they have to be 24 hours. It doesn't matter what day. It can be on the 7th day. It can be whenever that is. But they have to be 24 hours asymptomatic before I start doing my graded test of return to play protocol, which is actually a state law now here in Kentucky. And if we go on down, I'm at the recovery slide now. So it says how long asymptomatic before exercise. I want baseline 24 hours. Some people go really conservative and say 48, but I want baseline 24 hours. One approach, I don't do this, some people do, and it's okay if they do. If you have a doctor that overrules you, you have to take their orders, is that they remain asymptomatic for as long as they had symptoms. So let's say I had an athlete that was, having symptoms for 8 days. Now they tell me they're asymptomatic. We are going to rest them 8 days until I start doing my return to play protocol. Yes, it's a little far-fetched. I haven't run into that. I know some colleagues of mine have. So here is your, I guess it's a 7 day return to play protocol that we have in this state now. And I like it because on the first day, they come to me, they said they're asymptomatic, no activity. The next day, I'm writing down all their signs and symptoms. Did you have anything? How was your sleep? I'll go through best testing again. I'll go through my memory questions, which I'm going to show you. Probably cranial nerves. I'm going to show you all those too. And then we'll start some kind of light aerobic exercise. The thing about this graded test is what we have found out, if you raise the heart rate a little bit, gets the blood flowing, and sometimes it could recreate concussion symptoms. That's how crazy it is. I like that because, if you do have a true concussion, that kind of test is not going to lie. Some people can try to fake it if they have a little headache or something like that. They're trying to get back fast and they're lying to me. Not with this, because it's like I'm trying to elevate their heart rate and they don't know about it. So I only do about 20, 30 minutes maybe on day 2 if you're looking at this on the table here. Day 3, I go sports specific. If they're a football player, no pads, no anything like that. If they're a receiver, just taking them through a couple drills. I'm not even sure if I'm going to let them catch a pass yet. Just a couple drills, sports-specific, soccer player, same thing, okay? It doesn't matter what sport, you can pick a sport. Next day, day 4, non-contact training drills. This time, I will put them in pads. So let's just take the football player, for example. I will put them in pads, let them go through. Obviously, it's non-contact. Put a red jersey on them, whatever it is, and I'm monitoring them the whole time, about 30, 45 minutes. Nothing crazy. I want them to get a good sweat. I'm asking them beforehand, hey, how are you feeling? I'm asking during practice. I'm asking them after practice. They have to go through a whole set of things. If they're a high school player, anybody under the age of 18, I let mom and dad know, or parent or guardian, whatever, exactly what I'm doing, because it's going to get really excessive and it's going to get really, I don't know, like just weird for them. They're like, why are you asking me all these questions? It's like, I have to, all right? This is super important to you, super important to me. I want to make sure that you're coming back full-fledged and healthy, okay? On day 5, I'm at a full contact practice now. I am watching them like a hawk. I'm letting them go, asking them, hey, how you feeling? Whatever it is. If it's not a time limit. I'm letting them go through the entire practice, okay? Because on the next day, if they pass that, it's full go, okay? The biggest thing that I want to know, though, is if they have a headache, if it's real, if all of a sudden their heart rate gets up, they start getting symptoms. I had a kid one time, all of a sudden their eyes started dilating within 30 minutes. They're like, oh my God, my ears are ringing, my eyes are dilating. It's like, yeah. That's your brain's way of saying it's still injured and you're not ready to go. So we have to start back. If this happens, if they have any kind of symptoms that they had at the very beginning, we start all the way back to the beginning. You can see where this is kind of frustrating for some parents. Obviously, they get a little mad at me and stuff like that. I don't care. It is what it is. It's very conservative. It's a state law now. So it's like we're here to practice good medicine and good conservative treatment. So, but if they pass, they're full go, and I'm still going to monitor them either way. All right. I have on here, same day, return to play. I wouldn't do it with anybody under the age of 18. Okay, I'm going to tell you this, and it's hard to tell you this because I'm going kind of fast here. We'll get into more of this on-field stuff, but if anybody's under the age of 18, if you diagnose them with a concussion, you automatically start the whole return to play thing. Okay? I want you to know this. This is the last thing I'm going to leave you with. Think about this. If you get hit in the shin, what hurts? Your shin. If you get hit in the knee, what hurts? Your knee. Does the pain go away? Yes. It doesn't mean that you tore your ACL, you have a fracture. Bumps and bruises happens. If you get hit in the head, obviously what hurts? Your head. I take about 15, 20 minutes. I tell coach, I tell parents what I'm doing, taking them out, see if symptoms resolve within 5-10 minutes. I put them through a whole graded test that I do on the field and see if they have any other symptoms besides just a headache. Because guess what? It is a sport. It's a collision. I don't care what sport you play. Anything can happen. You can get hit in the head. You don't necessarily need to call it a concussion. But in the event that you do, if somebody at the age of 18, I go ahead and